When taking part in sports such as football, a mouth guard is a great way to protect your teeth. We meet Dillon, a professional footballer, have a chat about mouth guards and what to do if a dental injury does occur during sports. We also get to see how Sean has his own mouth guard made using our latest digital scanning technology.
Okay, Sean, so that's your scan done. Do you have any questions at all about mouth guards or anything that they're related to?
Yeah, how many types are there?
So typically we would say there's three types of mouth guards. The first type is called stock, so that's just one size fits all, and it's just one that if you walked into any local sports store, that's the one you would get. They're cheaper and they're quite bulkier, and you have to be kind of biting down on them to retain them, so we kind of wouldn't recommend them. The second one is something called boil and bite. So this is just effectively a bit of thermoplastic material that is heated up, and then when you bite down on it, it's moulded to sort of fit your mouth. The final one is a custom made one, which is the one that we've made for you today. Obviously it's a scan, so it fits you and you only perfectly. It's very good for if we expand the surface area of it. It's very, very good for absorbing force, which not only protects the teeth, protects your gums and your soft tissues in the mouth, but it can also, which not a lot of people know, protect the head from things like concussion. So I would say that the best for everyone would be a custom made one. However, kids in a phase that we would call the mixed dentition phase, so from about 5.5 to about 13, they have both adult teeth and primary teeth. So typically the primary teeth will be found in the middle, but at the front and the back will be adult teeth for these kids. That means that when there'll be very often times that teeth become wobbly, teeth fall out, new teeth come in. So the benefit of the boil and bite is every time your mouth sort of changes, you can heat it up, bite down on it, and it will remold. Another population group that is very good for boil and bite is kids with braces as well. So similar thing. If they've got teeth that are moving with their kind of train track braces and stuff, every time it does move, heat up the mould, bite into it and mould, and it will be something that can change as the child or the patient's mouth changes as well.
So what would happen if somebody wasn't using a mouth guard and a tooth came out?
So it would depend on the type of tooth that it is. So for kids aged up to about 5.5, it's unlikely to be an adult tooth, a baby tooth, and they fall out anyway. So what we would say to them is just leave them out, and hopefully as normal, the kind of adult tooth will come in and replace it. If it's an adult tooth, there's quite a simple analogy that we would go for. It's known as pick it, lick it, stick it. So you would pick the tooth up, holding it by the crown, and that's the very white surface that you can see in the mouth, and we would advise that you wouldn't hold it by the root. And then you lick it, just with your tongue, to clean it. And it should be the person whose tooth that has fallen out that licks it. And then you would just stick it back in. Just like that. And then go to a dentist as soon as you possibly can. If you're not able to put it back in, then some mediums that we would recommend you can leave it in is stuff like milk. And of course, when it's in milk, go straight to the dentist. So, Sean, is this going to be your first mouth guard for sports that we're going to give you today?
It is, yeah. Never had one before. I think safety's become a big thing amongst everybody in sport, you know, and yeah, the data is there now. You've got concussion subs, so I'm sure any manager or coach, you know, if they can avoid, you know, a player being out for 3 to 4 weeks after a bang of the head, then it'll benefit everybody. So I definitely think we need to get more people involved, and you know, the more people that are involved and are wearing them, the more acceptable it'll become.
Yeah.
So I think the more information we have, you know, the more equipped we are to make good decisions. And I think if the data is there to show, which it is, it's just a case of us getting the information out to everybody. Hopefully they'll accept it and start wearing the shields.
Great stuff. Well, I hope the mouth guard works well for you.
Yeah, so do I, mate. Thanks very much.